Abby.
I'm Sarah.
And I'm JP. And this is Patrick.
We're group number 1.
And our topic is shoulder bursas, subacromial space, and impingement. Here are some bursae in the shoulder, and they're depicted by the blue color.
Bursae are fluid-filled sacs between the bones, tendons, joints, and muscles. They are important because they provide cushions to reduce the friction between the bones and your joints. And they are essentially made from a special kind of tissue called synovial tissue.
Confused about what a bursa is? Let's try this quick demonstration at home. Think of a bursa like this. If you press your hands together and slide them against one another, you produce some friction. If you do this for long enough, you'll feel some heat. If your body moved with that much friction, it would be painful. This is how bursa actually work. So, to demonstrate, take a plastic bag and 1 squirt of hand sanitizer and put it in there. So, if you hold this in your hand, when you rub it together, there's less friction and it doesn't heat up. A bursa sac is an extremely important compartment in the body. Like a flat plastic bag with a small amount of hand sanitizer in the middle, like our demonstration before. Imagine now that these plastic bags with hand sanitizer in them lay between the regions of your body that move against one another, like your inside joints. And you could see how this would permit minimum friction and wear on the bones and cartilage by permitting a smooth gliding effect to take place.
Here are the 4 major bursae of the shoulder. You have the subacromial bursa, the subcoracoid bursa, subdeltoid bursa, and the subscapularis bursa, which is also known as the subtendinous bursa of the subscapularis muscle. In this picture, we have the subtendinous bursa of the subscapularis muscle. This bursa is between the tendon of the subscapularis muscle and the neck of the scapula.
The subcoracoid bursa, which is labeled as SC in the picture, lies deep to the conjoined tendons of the coracobrachialis, the short biceps tendons, and superficial or anterior to the subscapularis tendon.
The subacromial subdeltoid bursa is often referred to just as the subacromial bursa. It is a bursa within the shoulder. There are 2 parts to the subacromial bursa. There is the lateral part that creates a smooth surface for the acromion head and the deltoid to glide over the head of the humerus and the rotator cuff tendons. The medial part of the subacromial bursa cushions the coracoacromial ligament from the supraspinatus tendon.
Here is a picture of the subacromial space, and this space is between the acromion of the scapula and the head of the humerus, in which the supraspinatus muscle works. This area is also the home of the rotator cuff tendons, the subacromial bursa, and the shoulder capsule. Thus, this place can become quite cramped.
Have you ever had shoulder pain? Well, you might have bursitis. Bursitis is when the sacs of bursa in your shoulder become inflamed, and this leads to a condition called shoulder bursitis. causes of bursitis could be two things. One, repeated minor trauma of the shoulder joint being overused. This could happen in athletes, for example, playing volleyball. Number two, bursitis can be formed by a trauma like a fall. Overall, bursitis can lead to impingement. Because the subacromial space is crowded, there is a risk for a shoulder impingement, especially when the bursae are inflamed. Shoulder impingement is defined as pinching of the rotator cuff under the end of the clavicle during overhead motion. Shoulder impingement occurs during overhead motions such as abduction
or shoulder flexion.
Thank you for watching our video about shoulder bursa,
Subacromial space.
And shoulder impingement.